in what comes as a major boost for India's immunization program, vaccination program, is a report that has in fact been released by UNICEF. Now, this is the report, executive summary of the report, the State of the World's Children 2023, that has in fact been released by UNICEF. And then in this report, we are seeing that there are 3 countries who were able to prevent the backslide as far as the immunization program across the globe is concerned. That were India, Mexico and China. Now, I'm joined by Dr. Lakshmi Balaji, who's the Chief of Health from the New York UNICEF. So thank you for speaking with us. And you know, this report comes as a major boost for India, because when we talk about the vaccination program of India, when we talk about the immunization program as well, we have time and again pointed out the vaccination part as well, even the COVID-19 vaccination as well, has done really well when we compare it to the other countries. How, you know, what really worked for India? What do you think that they were, why do you think that they were able to prevent the backslide that we are seeing in other countries?
Thank you for that question. As the Chief of Primary Healthcare and Health System Strengthening, what I would say is India has a great infrastructure for delivery of health services, including immunization, and the confidence level of the public at large on India's immunization program is great. That is what the vaccine confidence report suggests. A reason why this has happened is because leadership coming from the very top of the country, successive years of immunization programs have been launched by the Prime Minister, by the President at the national level, and at the state level by the governors and chief ministers, and going all the way to the district and village level. Leaderships at all levels are committed to promoting immunization. Second, when you are promoting that, you need to make sure that the system which is responsible for delivery of these services are responsive enough and actually provide the immunization when families with children come into these centers, so vaccines are available. Third, they are delivering quality vaccines, and therefore there are not many side effects or adverse effects. So when there are quality vaccines, people are satisfied customers, and they know that their children are not getting these diseases for which they are getting these vaccines, and therefore year after year India has been able to do very well. And finally, when there are some pockets where immunization rates may not be very high, the government gets support from a wide range of partners, including UNICEF, to do excellent micro planning and address the barriers and bottlenecks which may have resulted in some children not getting those immunization, which we call as zero-dose children. And this micro planning, backed by very good campaigns and training of workers, and actively reaching out and seeking those children who have not been immunized, that is the way the immunization programs have been carried out, and these are now resumed full steam with the COVID taking not so much of an active phase as it is. So overall, I see a lot of hope and promise that India will achieve 100% coverage very soon.
Okay, but like you pointed out that COVID, of course, has taken, during the pandemic time, we have seen how there was in fact a backslide that was seen in major countries. So I want to point out here, in this particular report, it has in fact been highlighted that how India, Mexico and China were the countries that were able to actually achieve to prevent that backslide. Now, like you said, there are in fact pockets where there are immunization that is not, you know, has not been up to the mark. How do you think that the UNICEF is helping India in achieving that? Because even in this report, we are seeing that around 2.6 million children are still not vaccinated. So how are we going to bridge that gap?
We call these as zero-dose children. That is children who have not received the first dose of DPT or pentavalent vaccine. There are about 2.7 million children out of the 27 million born every year who did not get the first dose. And these are likely to be concentrated around certain pockets, as I mentioned, and these may be either because of certain gaps in understanding the value of immunization, or the families have been too busy and not been able to get the vaccine when they are free. So the idea is that in those pockets, the government agencies responsible for immunization undertake an extensive micro-planning to specifically address the inequities and identify what are the barriers and bottlenecks, either from a supply perspective or from a demand side, and accordingly develop their interventions and strategies. For example, if it is demand side barriers, then a lot more greater community mobilization needs to take place, and community education needs to take place, and local leadership, religious leaders, school teachers, all those who are likely to come in contact with families with young children need to be motivated to tell the families that if you have a child who has not been taken to the center for immunization, this is the day when the next immunization day is happening, or it is available on all days, as some of the centers do, and promote or advocate for those families to go and seek that immunization. That is looking at the demand side barrier. The supply side could be that there may have been geographical barriers, either in terms of flooding and things like that when the immunization campaigns were to take place, so there may have been some displacements, or there may be some supply related disruptions. So those are also addressed and remedied, and make sure that the provisioning is done timely and when the community's demand can be met, and actively seek out children and families who are not immunized, and that is how it is reached. And that way, although globally from 2019, when 13 million children were zero dose children, it went up to about 18 million. India's numbers have remained steady, and we hope now with the COVID hopefully behind us, these numbers will very quickly start reducing, and India's vaccination rates will go up very soon.
Yeah. Given the demography of India, we are seeing that, we are talking about urban as well as rural. When we talk about the transformation as far as the digital health or digitization is concerned, do you think that probably the digital platform could actually help to achieve that gap in rural areas as well? Do you think it will work in India that way?
The health workers, ASHA workers, and all of the others who have access to and are trained to use mobile phones for actively reporting on what is happening in the community are, and they in turn, when they analyze the data, they try to look at where are the pockets. Are these pockets concentrated around certain areas? As I was at the G20 Health Working Group in Goa that concluded yesterday, we looked at some of the organizations supporting the state government were able to identify certain districts, and within districts certain blocks having a higher concentration of zero dose children. That means that is the area where you need to mount a major educational campaign, and also maybe additional rounds of immunization to make sure that there is a catch up in terms of whatever numbers that are large can be immediately brought down. So those are and digital interventions and various digital measures of collecting that data and analyzing that data helps us see where we need to focus and quickly report on what is happening. Again, that's where real-time data and information helps, and that really the evidence dictates what the strategies have to be. And getting that evidence in real time is what digital health interventions help.
Do you think probably in India it is still a challenge to achieve immunization under the age of 5 years? Because when we talk about immunization, India of course have been shown remarkably doing really well. But do you think that this is still a challenge, this is still a difficulty because people are not really aligned to get children under 5 years to get themselves vaccinated?
For all countries, when it comes to immunization, you need to keep immunizing them year after year with all the vaccines as per the vaccine schedule. And we can't say, now it's time we can take a relaxation. And I think India and many of the countries which have been able to maintain the levels of immunization consistently for certain years, we know that it has happened, and it can only grow if they continue with that. And with this newer injection of digital health and other ways of contacting families, for example, to be able to send reminders to families through the mobile phone when their child is ready for the next dose. These are all newer things that are happening, and people have seen that e-Sanjeevani and Ayushman Bharat Digital Health Mission, all of these have helped their ability to access health services in the last 3 years. As long as these channels are used progressively to help accelerate the immunization campaigns, I do think that for children under 5 years in India and in all of these countries which take up these strategies, there is a lot of hope, and they will be able to do that.
All right. So that was Dr. Lakshmi Balaji speaking exclusively to us on the UNICEF that has released a report about how India has in fact been able to prevent the backslide as far as the immunization program is concerned. With Sumut Jawgiri, this is Shaina Elizabeth in Delhi for CNN News 18.